High blood pressure, type 2 diabetes, or are you overweight? If you do, take a listen. 100 million Americans have fatty liver disease linked to those conditions, but many may not know that it advanced to cause liver scarring.
Yeah, and that's a very serious complication. And before now, the only thing doctors could prescribe to treat it was diet and exercise. But now, the FDA just approved a game changer. That's what doctors are saying. Senior health correspondent Monica Robbins joins us now to explain. Hi, Mon.
Hi, guys. Yeah, metabolic dysfunction-associated steatohepatitis, or MASH, is called when fat builds up around the liver. It's often associated with high blood pressure, type 2 diabetes, and obesity, and it's estimated up to 10 million people have it. And now, for the first time, doctors have something to offer them.
Fatty liver disease scarring is the beginning phase of liver failure. It rarely has symptoms until later stages. And until now, there was no medication to treat it. Enter Rezdiffra, a new medication that uses the thyroid hormone to redirect fat.
It primarily works to burn energy that would otherwise be stored in your liver in the form of fat.
And before you ask,
is it a drug that's going to make you lose weight in general? No. Is it a drug that's going to make you lose muscle mass, which some weight loss drugs do too? No. That's not how this drug works.
1 in 3 Americans has fatty liver disease, and many don't know it advanced to liver scarring. Diet and exercise were the only options to control it, and that's still part of this prescription. And it's only available to a select few.
This drug is only approved for 2 and 3 scales, not for 0 or 1, which has very little or no scarring, and not for cirrhosis. Important to remember that.
So how do you know if you have fatty liver disease or if it advanced? Ask your doctor for a blood test.
The good news is your doctor probably knows about this. Your doctor has easy tools at their disposal without sending you to a specialist to know whether you are at risk for this.
Well, we don't know how long patients can take this drug, so as it becomes available, research will continue. We also don't know how much it will cost and how insurance will cover it, but it is likely going to be available to patients in the next couple of months. They'll likely need to see a specialist, though, in order to get that prescription, Laura.
All right, Mon, question for you. What about weight loss drugs like Ozempic and Wegovy? If they cause people to lose weight, doesn't that get rid of the fat around the liver? Would that be something that they could use?
You know, yeah, those drugs do. And ironically, there is research studying these drugs to see if they have the ability to help with liver scarring, also known as fibrosis as well. But that research is still far off, and it's not approved for this yet.
All right, Monica Robbins in the newsroom. Monica, thank you so much.